Norepinephrine is a very high-yield topic. We give it a 5 out of 5. It's a must-know for exams and boards, all right? It's also known as noradrenaline in some places in the world, or the common brand name is Levophed. It is a natural hormone and a neurotransmitter. Natural hormone means that it's produced naturally in our bodies. It doesn't need to be synthesized in a lab or something like that. It's a catecholamine, just like epinephrine and dopamine. And in fact, it's synthesized from dopamine in the sympathetic nervous system and also the chromaffin cells of the adrenal medulla. Lastly, it is a non-selective alpha and beta-1 agonist, meaning that it agonizes alpha-1, alpha-2, and beta-1. If you compare this to epinephrine, norepinephrine does not stimulate the beta-2 receptor very well at all. Okay? Now on to the mechanism of action of norepinephrine. Norepinephrine is an agonist of the alpha-1, alpha-2, and beta-1 adrenoceptors. And if you were to break that down further, it would be more of a stimulant for the alphas than beta-1. So physiologically, what does that mean? Well, that makes norepinephrine a great pressor drug. Let's talk about why and break down the effects of all three of these, alpha-1, alpha-2, and beta-1. So the alpha-1 stimulation causes the peripheral vasculature to constrict down very tightly, increasing the peripheral vascular resistance, thus increasing the systolic and diastolic blood pressure. So now on to the beta-1 receptor. Well, so usually we see with a beta-1 stimulation an increase in the chromatropy, inotropy, and dromotropy of the heart. However, in norepinephrine's case, what we see physiologically is more an increase in the inotropy, or the contractility. And the reason for that is that there is such an increase in the pressures that you actually get a compensatory baroreceptor-mediated reflex bradycardia that overpowers the beta-1, the normal beta-1 action of tachycardia. So the heart is beating harder, but just not necessarily faster. And as for the alpha-2, well, I don't have bullet for it because it is lower yield than 3. Okay, and I'm sticking with high yield stuff here. Remember back, alpha-2 is a feedback inhibitor. It inhibits or slows the release of norepinephrine that is naturally released from sympathetic nerves. But we're not talking about nerves that are being stimulated naturally right now. We're talking about nerves that are being stimulated by a drug that you gave the patient. These effects are happening because there's a lot of norepinephrine floating around in the system that we gave the patient, not because there's a lot of norepinephrine being released from the presynaptic nerve. So what is the difference between norepinephrine and epinephrine on the body? Well, because norepinephrine isn't great at stimulating beta-2s, the effect is sometimes called unopposed alpha-1. So remember, alpha-1s are constrictors, beta-2s are dilators. So because there's no, or at least very little beta-2 stimulation, you get strong, unopposed clamping of the vasculature. And this does a really great job of increasing the pressures. So let's look over at our graph here and talk about what's going on. First off, heart rate. We've already kind of talked about this. Norepinephrine is a beta-1 agonist or a beta-1 stimulator. Normally that would increase the speed and the strength that the heart beats. However, in this case, norepinephrine does such a good job at increasing the pressure that baroreceptors, through an increase in vagal tone, actually cause a reflex bradycardia, okay? As for the blood pressure, we break this down into two parts again. Remember, systolic and diastolic. Systolic is going to go way up. The resistance that it's beating against is greatly increased, so it's going to be quite a bit higher. The diastolic pressure is also going to go up. This is because there's very little beta-2 stimulation to balance the strong alpha-1. And lastly, of course, as I've said several times, the peripheral vascular resistance is going to go up a lot. All right? So what are the clinical uses of norepinephrine? Well, because it's such a good pressor, we use it mostly in cases of severe hypotension or septic shock. And both of these should make sense because norepinephrine increases both the systolic and diastolic blood pressure. Two really important side effects for norepinephrine include cardiac arrhythmias, which makes sense because we're stimulating the heart, and if it's prone to any kind of arrhythmia, this could just push it over the edge. Also, it increases the risk of a myocardial infarction. And this is because we are increasing the workload, which increases the oxygen demand, and in a heart that perhaps has narrowed vessels or stenosis, this could just be the straw that broke the camel's back. Okay, how about a knowledge challenge? Based on what you know of the mechanism of action, which is alpha 1 and 2 and beta 1 stimulation, what is another possible side effect of norepinephrine? How about bradycardia? Alright, so why? Remember, we're stimulating the beta 1 receptor, right? And that usually increases chronotropy, right? Yes, but remember, we are really increasing the blood pressure here. We're making the heart pump harder, and we're pumping that blood through a smaller hole because we're clamping down the peripheries. That shoots the blood pressure way up. Our body naturally responds to this increase in blood pressure through a feedback loop that is beyond the scope of this lecture. There is an increase in vagal tone to the heart, and the heart beats slower. So believe it or not, bradycardia is another possible side effect of norepinephrine. So if you picked A, good job. Let's move on. Oh, wait a minute. Why is urinary retention a possible side effect? This is one of the problems of norepinephrine. It clamps down on things, not just vessels, but smooth muscle in general. And this includes the smooth muscle in the urine outflow tract. Think of this. What about the drug tamsulosin? Tamsulosin is often given to help patients with benign prostatic hyperplasia. Tamsulosin is an alpha 1 antagonist. So on the flip side of that coin, norepinephrine is an alpha 1 agonist. Therefore, it is going to be harder to pee when you're taking norepinephrine. Alright, so if you picked A and B, good job. Let's move on. Wait a minute. What about tremor? We're really stimulating the adrenergic system. Remember, this is the fight or flight response. So yeah, you could be tremulous. And I think you know where I'm going with this. So D is also another possible side effect. We're clamping down on things. And that includes small vessels in the toes and the fingers. So if you picked all four, good job.